welcome to Health Live at Seniors Today. We are ready with yet another session of our series of health webinars that we've been conducting since June 2020. We've been conducting these sessions. We've had over 250 sessions so far. And today we are delighted to have here with us Dr. Vaibhav Bagaria. Dr. Bagaria is Director, Department of Orthopaedics at Sir H.N. Reliance Foundation Hospital and Research Center, which is in Mumbai. Before I invite him to speak, I'm going to introduce him. As I mentioned, he's a Director of Department of Orthopaedics. After completing his MBBS, he completed his MS in orthopedics at KEM Hospital in Mumbai. And thereafter, he pursued his orthopedic fellowship at the Medical College of Wisconsin in the US. During that fellowship, he received 2 international awards and also a diploma from SICOT in Belgium. There he underwent fellowship in advanced joint replacement and adult reconstruction in Germany and later at Perth. Dr. Bagaria has an experience of several years in orthopedics. Prior to his association with the H.N. Reliance Hospital, he worked full-time at Apollo Hospital in New Delhi, a care hospital in Origin Clinic in Nagpur. Dr. Bagaria has considerable experience in all the latest technologies in orthopedics at different centers of excellence around the world. He has published several peer-reviewed publications. He's been on the editorial board of many journals, and he has written several books and chapters. He received many national and international awards. He was selected to represent the medical community in the Beijing Olympic torch relay held in 2008. He's also the recipient of the prestigious Korean Award and the Leicester Law Award at the World Orthopedic Congress held at Istanbul. He is a specialist in various areas of orthopedic, the list of which, if I start with, we will finish by the end of this session. I am, without any further ado, I'm going to invite Dr. Bagaria to speak. He's not going to be making a presentation because, as you know, we've had quite a few sessions on joint replacement, on orthopedic issues. So you are familiar with what it is. So he will speak with us for 10-15 minutes. And those of you who have questions, as always, please put them in the chat window, not the Q&A tab as we would do earlier. Please put them in the chat window, and then I will take the questions and address them to Dr. Vaibhav Bagaria. Over to you, Doctor, and welcome.
Thank you for such a kind introduction. It's always a pleasure to talk to enthusiastic and energetic people like you. And as you were speaking just before this, I'm delighted to be a part of the senior citizens team. They always bring joy to us when we speak to them. Their knowledge, their skills is really something that is being passed on to the younger generations. And I'm proud to be a part of a team that can discuss and talk to you about several things. My brief today is to talk on bone fractures, that happen specifically as we age. And also, I'll be touching briefly on what are different replacement things that are being done. So if I look at why the fractures happen as we age, I think the primary reason for these fractures to happen is as we age, our bones become fragile. And the reason is that at a certain age, which is around 30 years of age, we have what is called as a peak bone mass. And then from that age, it's like a fixed deposit that we had. And then every year, unless we take appropriate care, a certain amount is being debited from that bank. So when the force is more than the strength, it will give way. And when it gives away, we have what we call as a fracture. So that's the reason that the fracture happened. And the most common of these fractures are the fracture around the hip bone, which we called as either an intertrochanteric fracture or fracture neck of femur. They are the most vulnerable area in our body as we age. So again, the hip fractures are not all the hip fractures are same. And primarily, if I have to look into the division, the basic broad division, there are 2 types of fractures that happen. One is outside the capsule, which is called as an intertrochanteric fracture. And the other one is within the capsule, which is called as a fracture neck femur. Okay. So the management of these 2 are completely different. When we look at the fracture neck femur, the ball is broken within a joint, and hence we have to replace the ball. Whereas an intertrochanteric fracture is a fracture that happened outside the joint, and in that case, we operate in form of what we call as a nailing or a plating. Our intent is to fix the bone. So that's the number 1 type of the fracture, which we called as the fracture of the hip. Just to reiterate, 2 types of fracture in hip. One is outside the capsule and one is the inside the capsule. And the management of these fractures differ in terms of the strategy the surgeon uses. Apart from hip fracture, the second common fracture that we have is around the fracture of the wrist, which is the radius bone, which is there. And that happens because people often fall on their outstretched hand. So the entire weight comes on the hand, leading to the fracture. Now, depending on the fracture type, the fracture configuration, the age, the activity, the level of expectation that they have, we can either put a plaster by getting the bones back in the position, or sometimes we put wires from the outside, and when the fracture is much more complex, we have to put a plate there. So these are the fracture of the wrist that happen. Another category of the fracture that usually happen is the fracture of the spinal bodies or the spine, which is called as vertebral fracture. And what happens often is when you fall, the vertebra get compressed. So you'll see there is a wedging. The good thing about these fractures are they tend to heal on their own. We have to just give supportive measures in terms of pain control, and most patients will feel better. However, they are most dramatic fractures because when you fall, the pain is sometimes immense and you feel that something has gone horribly wrong and it requires a major surgery. But fortunately, these vertebral body fractures are not something that requires surgery, and in most cases will heal on their own. Another group of fractures that happen when we age is the fracture of the humerus or the proximal part of the humerus bone or around the shoulder joint. Again, one of the causes is falling on the outstretched hand because the impact is or the brunt of the injury is taken by the shoulder. So that's the typical fracture that happens. Most of these fractures again can be treated conservatively, meaning that you don't require an operation, just a sling will suffice. But if the fracture is too displaced or the ball has moved out of the socket, in that case, sometimes the surgery is required. Apart from these fractures that I've mentioned, people have sometimes get rib fractures, small bone fractures, fractures around the knee, meniscal injuries with trivial fall as we age. Now, what I've told you is the management when these things happen. But as they say, the prevention is the best cure, or the most important thing to prevent this is to understand why they happen. And I think there are so many misconceptions. People believe that since they've been active throughout the life, they have never had a problem, they will not have a fracture. But osteoporosis often is a silent disease. You don't know that you have an osteoporosis. So if someone doesn't have a bone pain, it does not necessarily mean that they don't have osteoporosis. Because as I said earlier, we all have a peak bone mass at a certain age. You deposit calcium to the bones, make them a particular strength, and from there on the deterioration starts. There's no way to stop aging. We all know that ultimately whatever we do, we are gonna age. But there is a way to age better. And this is an often repeated theme when I talk to elderly people. The aim is to die as young as possible. That means that whatever measures that we can do to ensure that we are as close, not chronologically, but physiologically to our young age is the key. So what can we do to make our bones strong? I think the simplest thing is to take calcium at regular intervals. Most often, if our diet is good, the calcium levels are good in the blood. But in bones, that's not the case. Often after a certain age, a certain amount of calcium needs to be supplemented. It may not be daily. People ask how many days, how many months should we take calcium? My philosophy is simple, that you should take it at least for a year after you're 50, then take a few months break and then retake it. At the same time, supplement it with good nutritious food, because that natural source of calcium is always something that the body absorbs the best. The second thing is to have adequate vitamin D levels. I think in COVID, there was too much of stress on vitamin D, and rightly so, because not only does it do wonders to your bone health, they also have a very important role in your immune system. So these are the two very low hanging fruit in terms of medication. Another very low hanging fruit is activity. Simple things like 20-minute daily walk does wonder. And if you can complement it with some amount of weight training once or twice a week, that is like icing on the cake. Sone pe suhaga. So if you can do these simple things, the chances that your osteoporosis will progress rapidly decreases significantly. Apart from that, there needs to be some therapeutic intervention at times, and way we assess it. So if there's a person who comes to us where we believe that the bone health is not very good, we do a test called as BMD or DEXA. And this BMD or DEXA tells us that, oh, this person is in normal range, this person has got osteopenia, which means that the bone quality has started to get poor, or it is actually osteoporosis, meaning that he has reached a category where a strong intervention is required. So the BMD, which is the bone mineral density test, done using DEXA, which is a dual energy X-ray absorptiometry will help ascertain where you lie, the green zone, the yellow zone, or the red zone. If you are a green zone, you can be happy. If you are in yellow zone, that means that you need to be proactive. And if you are in a red zone, you need to be treated. Now, there are several drugs, there are several injections, and each one of them have their advantages and disadvantages. Broadly, 4 categories, but I will not go into detail because that's a medical knowledge, and an appropriate medical professional should assess and prescribe an appropriate medication for the same. So prevention is better than cure, and that is a key point that I want to highlight. And just to reiterate, calcium, vitamin D, regular walks, weight training, assessment on a periodic basis, and treatment where necessary is the key for preventing osteoporosis. So that's the first part of my talk. I've also been asked to talk about bone replacement. I primarily specialize in hip and knee replacement, and now we do it robotically. So there are a lot of misconceptions. So why are they done? So I spoke in the first part that sometimes the hip bone fracture inside the capsule, and that's one of the common reasons where we have to replace the ball of the joint. So the fracture around the hips are number one cause. But there are other causes around the hip joint replacement, around the hip, which requires a joint replacement. And there could be hip arthritis, a condition called as AVN, in which the blood supply to the femoral head decreases. And sometimes by birth, there is some defect. In that case, we have to do replacement. Coming to the knee replacement, knees are something that we use so often, and so they get wear off. So people ask me, should we wear our knee off? I said, of course, wearing off your knee is better than rusting it out. So when the knee wear off, when there is a cartilage or the covering, which is the smooth part of the knee, gets worn off, people are unable to walk long distances. In that case, fortunately, there are not many solutions to aging. But in the case of knee replacement, this is considered one of the most fruitful surgeries to give you the quality of life back. So that's how a knee replacement helps, by changing the cartilage or by removing the cartilage which is damaged and replacing it with an artificial joint is what is called as a knee replacement. Now, there are a lot of technologies available. We do it robotically. People ask me, what's the advantage of doing a robotic knee replacement? I say it's having an additional arm to provide safety, so that if in any case the mistakes are going to happen, they don't happen, there is an additional layer of safety. And also the level of precision that the human hands do not have, the machine executed better. Of course, it's a man and machine interplay. The machine, at least now, I don't know about the future. I don't know what future holds for the entire humanity. But at the present moment, it is an interplay between the man and machine that delivers the result for all of us. So we do robotic for our hip and knee replacements for the precision and safety. People also ask, is there an age for a hip and knee replacement? So no, it depends on indication. Of course, as you age beyond a certain age, you have got other medical illnesses that prevents an anesthesia to be administered, and that is a relative contraindication for getting a hip and knee replacement. But other than that, it's the condition of the person which determines whether he requires it or not. So I think I'll stop here, and I want this to be more interactive, and I would love to have questions, because I think that's something that will be much more fruitful for all of us.
Yes, absolutely. Thank you very much, Doctor, for this very detailed account of what is required and what is not required. We have a few questions that have come in, and more questions will come in because people were busy listening to you. This is a question from Sharda Parvale. Her question is, can bone density be increased after the age of 70? And how does one increase density?
Yeah. So it's a very interesting and important, pertinent question to this talk. So indeed, there are measures in which, by which the bone density can be improved, medically and non-medically. I mentioned in my talk that non-medically, the simplest way is to have good calcium-rich diet, maintain a healthy lifestyle, avoid tobacco, avoid alcohol as far as possible, walk regularly, do weight training twice a week at least. So that's the non-medical part of it. Medically, if you have got significant degree of osteoporosis or bone loss, then the medical measures need to be done. So they include medications or tablets, which sometimes we give once a week. Then there are injections which are injected subcutaneously. These are called as teriparatide that have to be taken for 3 months to 2 years. And there are newer categories of now anti-osteoporotic injections that can be taken subcutaneously every 6 months for maintaining the bone density and also improving them. However, unfortunately, the medical part of it works only till the time you take the medications. Once you stop it, they again start to reduce. Whereas the other non-medical part that I explained have a long-lasting or lifelong lasting impact. So the first things first, use the non-medical part of it. And then still, if you have osteoporosis which comes up on the investigation, then seek a medical help and get the right medications or injections as is necessary for you.
Right. Thank you very much. We have another question that has come in, which is from Sunita Verma. But the question is, my 26-year-old grandchild has a fractured fragment of bone around first. Okay, this question is not complete, but there's another one, which is from Sunita Verma. Can spine fractures occur without falling down in the elderly? In fact, there are two questions that have come in. One other question that I have received is, can fractures happen without any fall?
Yes.
With just weak bones?
So a certain amount of force is definitely required for anything to give way. But as I said, like anything in life, it's a pure physics principle that the strength of the force and the counter strength of the bone is what prevents anything from breaking. Like a piece of chalk versus a piece of wood. A chalk breaks with a simple breaking through a hand, whereas a piece of wood is difficult because the chalk is more brittle. So the more brittle you are, the lesser the force is required to break it. And sometimes it could be even without a force which you have registered. So fall is the commonest force we see. We know that a person has fallen, so the force has impacted its bone. But sometimes the force may be trivial, as like transferring from bed to a chair. Sometimes it could be a jerk in a car. I get several, even not so very old people, who say that they have never had a fall, but just when their car went over a speed breaker or a bump, that the next day they started having pain. And when we investigated them, they were found to have fractures. So it's sometimes just a matter of a very small, simple jerk, and a fracture can happen if your bones are very weak.
Right. Thank you. Those of you who are sending in questions, please put them on the meeting group chat so that others can also see the questions and perhaps not repeat the same thing. Put them on the message meeting group chat and send it to Seniors Today, which of course you can see. The other question that has come in is, can bilateral knee surgery be done at one go?
I'm unable to hear you. Can you repeat me the question?
Can bilateral knee surgery be done at one go?
Yeah, so we do around 30% of our knee surgeries bilaterally. So for that to happen, the patient have to be medically fit. Of course, they have to have right indication, meaning they require both surgeries. Number two is they want both surgeries. And number three, it is safe for them to have it. So in order of priority, when I look at a person, I look, oh, this guy requires both knee replacement. Then I ask them, are you wanting to do it both at the same time? And if the answer is yes, then we subject them to test to ensure that they are fit enough to undergo both surgery, because when you have both surgeries, body's resources get divided into two parts in healing. So if your body's resources are good enough, as a doctor, we assess it. We feel that yes, you are capable of handling a double stress. We go for surgeries. As I said, robotics is now what we use. And because of robotics, the amount of tissue damage has decreased. So we are much more open and liberal in doing both knee surgeries when we have robotics in hand compared to what we used to do earlier. So our percentage of doing both together have increased.
This is a question that has come in from a regular attendee. Doctor, we had asked a question to gynecologist recently about osteoporosis being hereditary. Are knee replacement and joint problems also hereditary?
So you do have a genetic predisposition to arthritis and osteoporosis both. So most diseases are genetically predisposed. For example, graying of hairs, for example, balding, all the aging process, if you look at a family history, have some degree of genetic predisposition. And on top of that, there is also a lifestyle factor. So it is always combination of multifactorial. So it's not a single factor. It's not just your age. It's just not your genes. It's just not your cultural thing. So people always give example. See, that smoker is there and he has never had osteoporosis. That's not the right thing. If you are genetically predisposed, if you are a smoker, if you do not do what I have said all, then you are likely to develop it earlier. But for example, someone has got some very strong genes in that aspect, smokes, doesn't walk, they may get later. So I think exact quantification of what causes what is difficult. But yes, there is clear evidence that there is a genetic predisposition to both.
Right. This is a question from Mr. P. Satyanarayan. His question is, at what interval after 70 is calcium intake advisable? And his next question is pan with tuna advisable?
Okay. So first question, again, there's no specific age point in which you should start calcium. For females, I always recommend that once they have attained menopause, they should carefully look at their diet. And if they feel that their diet is not supplementing calcium enough, they should externally supplement it. For men, it's usually after 60 that I recommend to seriously look at taking calcium. Again, no fixed rigid lines, but this is roughly what I do it in my practice. The second part of the question, yes, when you have tuna, there is some amount of calcium, but this calcium is too little and we do not know the exact absorption that it happens. So while it will be incorrect to say that it has no calcium, it is definitely not enough, or it cannot be used as a substitute for a proper calcium supplementation.
And obviously there are some other problems that could happen.
Yes, because of course, yeah. So so of course, the way you take it is also important. Yes.
So this is a question from Mr. Anil Singh. Is when can a person who's had knee replacement drive a scooty, and after how many days of operation?
So very good question, and I'm often asked this question. So yes, most people will be able to drive scooties. Okay? And it doesn't depend on implant or surgery. It depends on muscle strength. So if your muscle strength is good, if your stability is good, then you are safe to drive scooty. Safe for yourself and safe for the person on the road as well. So as a doctor, I have to look for both the safeties. Time period, typically anywhere between 4 weeks to 3 months. Some people recover fast, some people recover slow. So it's not a race. I always tell again that don't be in a hurry to do it. It's be in your comfort zone. There is a very thin line between bravery and stupidity. I tell my people to be brave but not stupid after the operation. So you can push your boundaries, but don't be stupid, because when you want to do things too early or too quickly or want to show off, that also is wrong and someone can land into trouble. So everyone has a different time zone in which they recover. Typically after 3 months, most people, I'll clear them off to drive a scooty, especially the self-start ones.
Right. Doctor, we have a question which is, I have heel pain since many years, especially in the left leg. What is said to be due to plantar fasciitis? Should I go for surgery of this heel spur? This is at age 63.
See, for heel spur, my experience tells that 90% of people just improve with physiotherapy, having soft sole slippers, not walking barefoot, and some supplements. 90% of them will get cured with that. The rest 10% may require an injection to be given. And the surgery is only required in 1% people who are completely, have tried all that, have tried all the lifestyle modification, have used soft sole slippers, have undergone physiotherapy, have taken injections, sometimes multiple injections, and yet have not been cured. So that tiny 1% of people would require surgery for plantar fasciitis. Of course, it's quite dependent on what we find clinically. But it's a generic statement that I want to make on this.
Doctor, we've received so many questions that we can go
No,
well
I'll try to be
past
quick.
midnight,
I'll try to be quick. Okay.
past midnight, but it's okay. No, sorry, I'm not trying to rush you, but it's just that the number of questions that have come in, it just shows, one, of course, the fact that, they want to ask you the questions, but it also shows the amount of, the thirst for knowledge or the
Yes.
desire for good knowledge. This is a question that is, I'm lactose intolerant. My calcium level is good, but doctor, my vitamin D level is in reference range of 30. Is there anything to be concerned about it? I take calcium and vitamin D combination tablet alternate days.
So again, as I said, calcium in blood is not a correct marker of calcium in bone. So I would recommend, especially for lactose intolerant people, to get their DEXA scan. So they are doing right thing by taking calcium and vitamin D, but they may require something additional for osteoporosis if their DEXA scan shows a significant degree of bone mass reduction. So it's don't go by just blood calcium. It has to be the calcium in bones.
There's another question that has come in. There's a message circulating on WhatsApp that after a hip fracture, a person dies after a year.
See, I mean, it's a half-truth thing. See, the reason why they say is there is a significant mortality after a hip fracture, not because of the surgery. Okay, so they say the studies have shown that there is 10 to 20% mortality after within 1 year of having a hip fracture. The reason is not because they have undergone a hip fracture. The reason is why they have had the hip fracture in the first place. So we clearly see two groups of fractures. One group where the force of injury was substantial and they have had fracture. These are the patients, you operate them, they get fixed and they are very well. The other group is, when we started our discussion, is the group who had no injury or they had a very minor trivial fall and had a hip fracture. Now, when they have this hip fracture, that means that their bone density was extremely low. So it's a surrogate marker of a severe degree of physiological deterioration in body. So hip fracture by itself is a manifestation of something bigger, that the body is not physiologically optimized. So the person who have had hip fracture is likely to have other problems, and most of them are going to be silent. And hip fracture is just an uncovering of cascade of event that is going to be. So correlation is not causation, they say. So hip fracture is not the cause of the mortality, but it is correlated with an increased mortality at 1 year of around 10 to 20%. Not because of the surgery, but because the hip fracture happened as the starting initiative point of a cascade of multiple events.
Right. Thank you. There's another question from Seema. She says, I'm 64. After an accident, I had to undergo a long spine surgery 2 years back. Should I still take care, such as not to bend and not to carry weight?
See, that it's quite case-based. I think depends on what surgery they have. There are many spine surgeries in which we simply say do everything. And there are certain surgeries in which we have significant amount of restriction. The right course will be to meet the doctor who did the surgery or go to another doctor if he's not available, get a proper X-ray done and take a proper medical advice on this issue.
Right. Doctor, just two more questions. This is from Jaya Prasad, who has a clarification. I've had a meniscus tear due to sprain on the left knee 8 to 9 months back. Due to this, I have a problem of first 5 to 10 minutes of walking immediately after getting up from bed or after resting continuously for an hour or so. I have been advised some painkillers and vitamin tablets, apart from regular walking and active engagement. But I want to know how long this problem will continue and when will I be away from medicine?
So 90% of meniscal tear which happens after the age of 45 or 50 years are again age-related changes. So normally meniscus are like cushions. They have got certain degree of pliability. As we age, the water content from that goes away, making them prone to tear. It's like paper. As the paper ages, you are able to tear it more often. The meniscus behave more like an aging paper. Fortunately, 90% people will become better automatically between 3 to 6 months. Some people take longer, up to 6 months, but majority of them start feeling at least 90% better at 3 months. A very tiny proportion of people who continue to have mechanical symptoms like locking, like giving away sensation, require an arthroscopy that's done through keyhole to trim the meniscus or clean it up. but majority, as I say, will improve between 3 to 6 months.
Doctor, this is a question which at least 3 people have asked us. One is, is milk required to be taken with vitamin D tablet for better absorption? One second is milk an essential requirement for better bones? And third is that what is the type of milk should one take? Should one take A2 milk, or is just a regular milk all right?
Okay. So the first question, the vitamin D is a fat soluble vitamin. So while it can be taken without anything, the absorption is better if there is some degree of fat available, and milk does contain fat. So if someone asks me between water and milk, what's preferable? Milk is a better alternative, but it is not compulsory to take milk. It's just that the absorption of vitamin D is better with things that have small amount of fat in it. Number two was milk. Whether it is essential for milk is a good source of calcium, specifically for vegetarian population. Okay, so I think and it's easily accessible. So any solution, if it has to really work universally, has to be accessible and affordable. I think milk is one of those simple solutions. And similarly for non-vegetarian population, egg. I think there are two wonder foods which are not promoted because they are cheap, are egg and milk. I think accessibility and affordability with these two products are the highest, and the returns that they give to our body are the best. So I recommend it. And third is different type of milk have different calcium content. But again, the difference is too small to pay a huge price for it. If it's accessible and affordable, simple milk will also serve the purpose.
One last question, and then I'll ask you something else. This is from Ritu C. What are the do's and don'ts after a plate insertion for an ankle lateral malleolus? And how long does the healing take?
Again, it will depend on what type of surgery was done, whether the ligaments were fractured, ligaments were torn or not. What was the state of the other bone? What was the state of your own bone when the doctor put in a plate? So it is multifactorial, and we cannot generalize an answer to that. Roughly, most bone take 6 weeks to 3 months to heal, longer when we age and when our bone stock is poor. Okay, so yeah, so I think it will depend on what kind of fracture you have had.
Right. And my question to you, Dr. Bagaria, is how do you take care of your bones? Because obviously you're not that old, but at the same time, given all the stresses of work, etc., that are there, and plus I don't know whether you are a vegetarian or a non-vegetarian, but what do you do to take care of your bones, and how do you ensure that you have better bones by the time you are a senior citizen?
You're taking away all my secrets and making me so I don't do as much as I should be doing, I must confess, number one. And I think most of us, even though knowledgeable, often do not do as much as they should. Okay, so I'm guilty of that. Nevertheless, I have made small changes in my life, and I think that makes a difference. And you rightly said that sometime in busy lives we do not know how to do it. So, for example, I truly believe that I should finish 10,000 steps before I sleep. So I've got this watch here, and you can see there are 3 rings. I don't sleep till all the 3 rings are closed. That's my number one thing. So even if I come home at 10:30, that's a motivation for me to take at least 4 rounds in my compound before I go. And I do it in my formal shirt. So often my building people know that Dr. Vaibhav will have a laptop bag in a hand, will be fully dressed, having a formal shoe and still walk. Because I believe that it's in walking that is more important than the outfit. And I tell this to you. So do with what you can with whatever you have. So that's number one mantra for me. I drink milk. I'm a vegetarian. So I'm an vegetarian, but I eat egg 4 times a year. So it's like just sometimes there. At my home, I don't have egg. So it's milk for me. I also consciously try to have more nuts in my diet. So in between my consulting, I've got an anjeer ka dabba and a dry fruit ka dabba, which I just pop in between. So that's my way of, again, twofold, giving me energy that I need. At the same time, they are nutritious food. So very small changes. I think the beauty of small changes in habit, the book Atomic Habits, I think it's about those small changes that you can make. You don't need to be big changes. I don't have a gym membership, but I walk every day. I'm sure. So that's the simplest thing to do. Make small changes, stick to it. If you are able to do that, you'll be good. I also try to do weight training when I can. So a little bit of weight training. Of course, my job as an orthopedic surgeon, I'm fortunate enough to have a job where I can be physically active despite being a doctor. Most doctors do not have an opportunity to be physically fit. I have to use hammer, I have to use saws, I have to use this. So I always kid that it's a sports for me. So when I do a surgery, I think that I'm like a sports person. It's mental as well as physical. So yeah, I can do more, but I walk. I pay focus on my nutrition. I try to do weight training whenever I can. Of course, I've not reached the age where I do my DEXA scans, but I'll shortly reach. I'm 48. I'll become 50 in a couple of years. Maybe after that, I'll start doing a regular DEXA scan for myself.
Thank you very much, doctor. And you obviously are able to do this walk despite the fact that it may be raining cats and dogs in a city like Mumbai.
I do that, and I actually enjoy. And once you start doing it, you'll start enjoying rains. You'll start enjoying everything that is around you. Once it's your habit, everything else becomes secondary. Trust me, it does. And the rains don't matter to me.
Absolutely. And if you have a nice place or playlist of rain songs,
yes,
as they say, Sone Pe Suhaga. Thank you very much, Dr. Vaibhav Bagaria, for this session. You've answered several questions. You've given us a very detailed talk. As you all know, that this session, the edited video of this will be up on the Seniors Today website on Monday evening. Yes, we are open on Monday evening, which is Janmashtami Day. So it will be there up on the site on Monday evening. You can take a look at it. It also has takeaways, which are written by a qualified medical practitioner. So do take a look, so that even if you have missed out on something that doctor has said or doctor has responded to, and you've not taken notes, you have the opportunity to hear it all over again. Once again, thank you to Dr. Bagaria for being here, and thank you to the team at HN Reliance Hospital to facilitate this. We will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. We're doing something on kidneys next Saturday, so be there. I know a lot of people have requested for something around kidneys, so we've responded to that, and we will take all your questions then. Thank you very much once again, Dr. Bagaria. Would love to have more of your fraternity from the HN Reliance Hospital in future as well. Thank you very much.
It's been an absolute pleasure interacting with you, and with such an enthusiastic audience. In a short span, we almost literally covered all the aspects pertaining to the topic. So kudos to you for such a wonderful moderation, and also, of course, the audience who put their questions so forthrightly. Thank you so much.
Thank you very much.
Pleasure.
Thank you very much. Thank you.
It's been a pleasure.
Subscribe now and press the bell icon. Never miss an update.